Okay, good morning, everyone. We are excited to get started on our part two today of our series event, The Story of Your Genetics. As a friendly reminder, please select all panelists when typing questions into the chat or Q&A box throughout the time period. Today, we are privileged to host Katlyn Frane and Emily Toering for their talk on learning your family health history. Caitlin and Emily are both genetic counselors at Marshfield Clinic Health System, and we are happy to have them here with us today. Please welcome Caitlin and Emily.
I think we're just getting our slides up, but thank you so much, Nate, for that introduction. Hi, everyone. I'm Caitlin. I also have my colleague, Emily, here, and we are really excited to talk to you all about family health history, its importance, and how you can navigate some of these conversations. Of course, being genetic counselors, we will also talk a bit about our field and how family health history plays a role in that. But if you could go to the next slide, please. We would like to take a quick second to ask you guys a few questions. We don't really have a poll, but would like you to just think for a moment about you and your family's health history. What do you know about your family's health history? What don't you know? Do you know relatives that have certain health conditions? Do you know what those conditions are? Do you know if your family member passed away, what they passed away from? Do you know what age someone was diagnosed with something? Do you have a personal health history? Do you share any of that information with anyone? What challenges do you face in sharing some of that information? So I know that was a lot of different thought-provoking questions, but kind of keeping some of those thoughts in mind as we chat today. Regarding that last point about the challenges of sharing health information, we do recognize that while a lot of this information is important, it's not always easy or even possible to obtain it, and that is okay. But if you could go to the next slide, just a quick overview of today for our short time with you, our agenda, talking about family health history, why it's important, and then Emily will talk a bit about what we do as genetic counselors and how family health history is really important to our work and how we assess our patients. And then we'll also briefly talk about some strategies to have some of those more difficult conversations. Next slide, please. So just first taking a look at your health. If we think a bit about our personal health and what that encompasses, really we have our genetic profile, our environment, nutrition, habits, some social determinants of health, and then probably a piece of our health that we're not really sure how it contributes to different medical conditions. And if we think about all of these pieces, these are also pieces of health that your family has. And so these are all shared with our family. Go to the next slide. So the extent to which these different pieces are shared varies, and how much it varies changes from person to person within a family. But given you and your family do share these things, that's why it's really important to learn about each of these pieces from your family's perspective. So if we think about our genetic profile, that one probably feels a little bit obvious. We share our genetic information with our parents. They shared that with their parents. So if there are any known genetic conditions in the family, what are they? And then keeping in mind, this is really important to assess if this is from a biological relative. So family members through marriage, or if you know that you're adopted or a product of artificial reproductive technologies, so like sperm donation or egg donation, or even if you were adopted, making that distinction can be really important when thinking about your genetic profile and how it contributes to your health. Your environment. So families tend to live in the same areas, especially for those first 18 years of life. But then even after that, we do see families tend to stay in the same areas. So whether you live in a rural area versus an urban setting, that can also impact your health. what you eat. We all know we have, great grandma's recipe that has been passed down for generations. So what you eat and how much you eat and, the extent to the variation in your food tends to stay consistent throughout families. Um, and then your habits. So whether your family is really active versus really sedentary, if some of your family members have different habits like smoking or chewing tobacco, keeping that in mind when assessing family health history can be important. And social determinants of health. So these are a little more convoluted and intertwined, but things like socioeconomic status, how educated your family is, so how many levels of schooling they went through, and then what community your family lives in, all can contribute to your health. And then there's, again, that unknown piece. So all of these different pieces of your health really do interact, but we are still learning to what extent they interact and how that can impact each individual's health. But because these different factors are shared, that is why your family's health history can really be so informative for your own personal health and when your providers are trying to assess your risk for different medical conditions. So if we can attribute one of these factors to a health condition experienced by one of your family members, that can impact your risk for that condition because that is likely a health factor that is shared with that family member. So to dig deeper into that idea, really particularly from a genetic standpoint, Emily is going to talk more about our careers as genetic counselors and how family health history impacts our work.
Yeah, so we've talked a lot about health history and what that really means, but now I think it's important to talk a little bit about genetic counseling, as family history and health history is part of our job. So whenever I tell anybody I'm a genetic counselor, the first question out of their mouth is, well, wait, what is that? Are you a doctor? What does that really mean? And I really like to think of our career as an intersection between three main domains. So that first domain would be a complex genetic information. So all of us have instructions that tell our body how to develop and grow. And we all have differences within this genetic information, whether that be an extra page, a missing page, or even spelling differences within that genetic information. Genetic counselors are really trained to help identify and understand those differences and then help select the correct test when looking at those differences. So we've got a lot of different tests that we can do, but they're very dependent on someone's clinical picture and the conditions that we see. So for example, although both a microwave and an oven do heat food, you probably wouldn't want to cook a pizza in a microwave. So something similar to that, where we are trained to help select what testing is best for a clinical picture, and then to move over into the clinical implications zone of, once we get these results back, what does that really mean for patient? So sometimes we'll get a result back and it'll be a perfect match, and sometimes it's not so much of a perfect match. So really figuring out, have we found our answer for patient, or is there other testing that we may be able to offer? Along with that, we do work with individuals with rare conditions. So we may be providing information like, should they be going to specialists? What screening should they undergo? Should they have their heart checked out? Should they have their kidneys checked out? Are there any medications that they should be taking? Are there any medications that they shouldn't be taking? And connecting them with resources, not just a great clinical team, but also support resources or other resources that may be helpful to them. And then lastly, I think most importantly for us is this patient care domain, or really working with patients to explain all of these complex genetic, that complex genetic information, those clinical implications, and bringing it in and saying, okay, we have all of this information, but what is going to work best for you and what's going to work best for your family? Ultimately, genetics is a very complicated field to work in, but also a very personal field for individuals and their health, where a diagnosis may not just impact one individual, it may impact multiple individuals throughout a family. So really navigating that tricky situation is what we're trained to do. So you may be wondering, okay, where would I see a genetic counselor in practice? And generally there's four main clinical areas that we practice in, although our field is expanding out all different ways. So the first area, or the areas are kind of grouped by lifespan or where you're at in life. So we see people prenatally, in peds, adult, and cancer. So typically, to give you some examples of why we would be seeing people for different indications, during pregnancy, we may be looking at a family history with known genetic conditions running in it, or we may be meeting a family to discuss a birth defect that was seen on ultrasound. In peds, we typically meet children who may not be developing as we would typically expect, or who may have some serious health concerns where the question is this genetic and something that we can provide more guidance on? For the adult realm, we may be meeting people to talk about heart health or neurological conditions. And then in cancer, meeting with people with cancer or a family history of cancer to really see, are they at an increased risk for different kinds of cancers, and how that genetic change may change what treatments we recommend or how we may follow them. So these are all very brief examples, but Katlyn and I are actually general genetic counselors, so that means we see everybody for everything. And so it can get a little crazy here at clinic. But I do want to share a few cases with you guys, but before I jump in, and again, these are clinical scenarios, not based on any person or anything like that, but I do like to hit on the differences between hereditary and genetic. I know within the media, they're portrayed as similar or the same thing, but in our realm, they're two different things and things that we have to think about when talking about different conditions that are being passed on in a family or these genetic changes. So hereditary, or this hereditary box, is just something that's being passed on from generation to generation. That could be a health condition, or it could also be something as benign as eye color or hair color. Not all things that are being passed on from generation to generation are bad, but it's something that we keep in mind as well. And then genetic means that a condition or something is being caused by specific changes within that instruction manual or in their genetic information. So conditions can be just hereditary, could be just genetic, or they can be both. And it really changes how we may go about testing or what testing we may offer a family in different situations. So I have some examples here, and I'll navigate or I'll orient you guys a little bit. But what does this really look like in the clinical setting? Well, with this example, this person is coming in worried about their pregnancy. And this little box diagram thing I have here is called a pedigree, or a family history, or a family tree that we draw out during an appointment to really see what else is going on in family history. Is there anything else that we may be concerned about when talking about health conditions running in a family? So squares are males and circles are females. So we've got the couple right here, and then their pregnancy, which is marked out with that P. So this couple came into genetics to discuss genetic testing, as they recently found out that their niece was diagnosed with an unknown genetic condition. They weren't sure what the genetic condition was, but they did know that she's been in the hospital since birth, and they were really worried about what this means for their current pregnancy. So at this point, I didn't really have any, or I don't have anything that I could offer them in terms of testing, because there's thousands and thousands of genetic conditions, and we really don't have a good indication of what this may be occurring in niece. So I would ask that they go home and talk to niece and mom's brother and really ask what's going on, so they could bring that information back to me and I can help direct testing. So they come back and it turns out that niece has Down syndrome. So Down syndrome is a condition where somebody has an extra 21st chromosome. So this extra genetic information can cause developmental delays and birth defects such as heart defects. It's a lifelong condition and there aren't any cures. But now that we have this information, I can make a plan for the family in terms of testing. So for Down syndrome, we know that this condition is a genetic condition, meaning it's caused by changes within the genetic information, but that it's typically sporadic, meaning it just kind of happens by chance and not something that we typically see running in a family. So it's not hereditary. So when talking to this family about their pregnancy, I would be able to reassure them to say, we know that there's not an increased risk for your current pregnancy just because your niece was diagnosed with Down syndrome, as typically it just happens by chance. So they didn't need any genetic testing and they can go about their pregnancy. But what if it was something else? So same situation, a couple comes in talking about pregnancy and this unknown genetic condition, and I send them off for more info. Well, in this situation, niece comes back with cystic fibrosis. And cystic fibrosis is a condition where somebody inherits two genetic changes on the same gene, and it leads to thick mucus that builds up in the lungs and more infections throughout their life. And this condition is life-threatening and has no cure. But because we know that this condition is caused by both genetic changes or changes to that instruction manual and is something that you can inherit from generation to generation, we would know that testing is something that we can offer and would help clarify the risk for this pregnancy. So now that we know what condition we're looking for and what the concerns really are within the family, we can offer targeted testing for that specific condition. So now I do want to say that we don't expect you to know if a condition in your family is genetic or inherited or both. That's part of our job. But we only know what you know about your family and what you share with us about your family. So that can be really important about pregnancy, but it can also impact other things like a cancer diagnosis. So in this example, a person comes in with a diagnosis of cancer. So she's a 53-year-old woman, and she's got no history or family history of other cancers. So over here, you can see that we have this testing criteria, and that's from NCCN, basically a criteria that helps us determine if an individual is recommended to meet with genetics and to undergo genetic testing. So for people over the age of 51, you need some family history as well to get that referral to genetics. Meaning a family member with breast cancer under the age of 50, a family member with ovarian cancer, a family member of pancreatic cancer, or two family members with breast and ovarian cancer. So at this point, a patient wouldn't meet those referral guidelines, meaning that she wouldn't really be offered a genetics appointment unless she specifically requested it. Now, say it's the holidays, she goes home for the holidays and finds out that her aunt actually did have breast cancer when she was 43. Now, looking back at these testing criteria, things change as suddenly we have one family member who had breast cancer under the age of 50, meaning that this patient does meet testing criteria, and we would recommend that she at least meets with genetics to discuss what that may mean for her and offering genetic testing if she's interested to see is she at an increased risk for breast cancer or other kinds of cancers. So family history can be really helpful for us when talking about conditions running in the family and being able to interpret risk and other health concerns. But ultimately, we only know what you're sharing about your family history. And I think that's the perfect spot to hand it back to Katlyn to discuss a little bit more about how to have these conversations.
So Emily and I, we're trained to have these conversations and tease out a lot of this information. Plus, when people come to see us in clinics, they tend to be more willing to share a lot of this information. However, we recognize, like I said at the beginning, these can be difficult conversations to have, and want to remind everyone that while we encourage having these conversations and gleaning this information, that might not always be possible, and sometimes those conversations aren't even fruitful. But as providers, we are still going to do our darndest to treat you the best that we can with the info we do have. That being said, we do have some tips for how to start some of these conversations if you are comfortable doing so. So next slide. Naturally, we want to have these conversations really respectfully because health topics can be quite sensitive. But tip number one is starting by sharing your own health history if you are comfortable doing so and if you have something to share. So you could even start with something very simple, such as, the doctor said I had really high cholesterol. Is that something the doctor has ever told you? And that can kind of pinball and result in a family member saying, yeah, that is something my doctor has told me. It was something that they told grandma too. And you might find out that a lot of other people in your family also had high cholesterol. And that tends to be a pretty basic thing. And you could find out, like I said, really quickly that other people also had high cholesterol, or you might find out that maybe other people didn't, and that could be more of a red flag for how to treat you. Additionally, when you bring up one health condition, that often can pinball other conversations as well. So no, the doctor never said I had high cholesterol, but I had hypertension or high blood pressure. So that can be a good way to start some of those chats. Tip number 2 I have is to inquire further and follow up. So inquiring further, I feel like a lot of us have maybe heard murmurings from family members about someone having cancer or having been to the doctor. If you're comfortable and close enough with that family member, ask. So, Grandma, I heard that you went to the doctor recently for, concern for cancer. What happened with that? Did you get a diagnosis? What type of cancer was it? So on and so forth. And then if grandma is actively dealing with a diagnosis, I think it can be really important to follow up with those individuals. We're asking for really, like I said, sensitive information. So beyond trying to get that info from someone, reaching out again and asking them how they're doing with that diagnosis can be really beneficial for your relationship, but also supporting that individual through that diagnosis. So inquiring further, get all the information, but also following up to support that family member's diagnosis as they're going through it. And that really bleeds into kind of my last tip, which is for these conversations, give thanks and also give grace. If someone in your family has been vulnerable with you, thank them for that information, because a lot of times, even if we are past a diagnosis, it can be really difficult to relive some of those thoughts and feelings of surrounding that diagnosis, especially for something that's a little more serious like cancer. And then in the same breath, giving grace if someone is not ready to give that information. So like I said, while this information can be really helpful for you in kind of learning about your risks, that individual may not be ready to share some of that information, and respectfully giving them that space to make that decision for themselves. I think also in that same line, asking for help. So if you have health history that you would like to share, but you feel like you don't have the right resources to do so, or you feel like you can't remember all the details, different providers such as genetic counselors are very willing to help you put together what we call a family letter, and it highlights those really pertinent details that those family members should know if they want to take that information to their doctor as well. So sharing your health history, being mindful about asking for help if need be when sharing that info, inquiring further to get all the details that would be pertinent, but then following up and giving thanks with those that have shared are kind of the tips we have regarding sharing family history today. Speaking of giving thanks, not only is November Family Health History Month, the NIH has declared Thanksgiving as Family Health History Day. This is because conversations like these are a lot easier to have when we have our family members around us, and people tend to get together for Thanksgiving. So potentially, striking up a conversation at that time can allow you to get a lot of information quickly, and sometimes can help you get a little bit more accurate information if there's multiple people to kind of chime in on what great grandma did or did not have. And it also makes it easier to revisit this conversation. So Thanksgiving comes once a year. That could be that touch point your family has to revisit this health history conversation, because your health history and your family health history is going to change 100%. And keeping that information up to date keeps your providers up to date on the best ways to care for you. Kind of in line with that, you can imagine if you have 5 brothers and 8 aunts and uncles and grandma and grandpa, there's tons of people in your family really quickly. So keeping track of that information probably feels a little overwhelming, but there are some really great tools out there to help you keep track of that. So the Surgeon General has this tool called the My Family Health Portrait, which really helps narrow down those really specific details. So like age of diagnosis, what the diagnosis was, and how treatment went are kind of the big 3 we tend to think of. So this is just one tool. There are lots of different tools out there, and I've even seen families use just as simple like Google document or an Excel spreadsheet. And then sometimes there can be someone in the family who almost volunteers as the family health history historian, so they tend to know everything about everyone, but keeping it all in one place is a good thing to do to make sure that information is updated and continually updated. All right, well, that is it for our content for today. We definitely appreciate everyone joining to listen in, and we'd be happy to answer any questions.
Yes, thank you so much. So we do have a few questions in the chat box and Q&A. One of the first questions is, how extended should your family health history go? Should you focus on immediate family, like parents and siblings, or look beyond into aunts, uncles, cousins, etc.?
I think that's a really good question. And I think it really depends from family to family. And typically, we like to start with immediate family members as you share the most genetic information with them, but you also share a lot of those other factors that Katlyn had talked about with them as well. So if you really can, if you can only focus on some family members, we would say that you should focus on your brothers, sisters, and then your parents. Past that, aunts and uncles are great as they're kind of those second degree relatives. And we say that once you start getting past kind of grandma, grandpa, you're not as genetically related to those individuals. And it's okay if those records maybe aren't as firm as, again, very direct or close relatives.
Yeah, and another question, is genetic testing typically covered by insurance?
That's an age-old question. And the short and sweet answer is it depends. I think most genetic counselors at this point are pretty good about figuring out for your type of insurance the extent to coverage that will happen. But it depends a lot on your deductible, the type of insurance you have, depending on who you see. So if you see us, there's certain genetic testing labs we use versus if you see someone in Milwaukee, they might use a different type of genetic testing lab. And then a lot of those labs have different patient assistance programs as well. The lab we use, they have a patient pay price of $250 if insurance doesn't cover testing. So it tends to be relatively affordable, but we do recognize that there is a little bit of an access issue when it comes to paying for testing.
Absolutely. Another question, can you retest for genetic tests years after your initial diagnosis is made to find out if newer tests came out to identify genes that may be associated with the condition? Say, for instance, a chromosome abnormality.
I think
I can
that's a
read that
good
again
question.
too.
Oh, sorry. I think that's a good question of we thinking 10 years ago, we know so much more than we did at that point. And I think it's always advisable to follow up with a genetics team if you're curious about in your specific case, is there updated testing for me for this condition, whether or not you found a diagnosis or did not, as we've gotten really good or we've gotten, I should say, we're getting a lot better at diagnosing different things or finding out answers when we couldn't 10 years ago. So I would definitely encourage, if you're curious about if there's updated testing, reach out to a genetics department or ask for a referral just to see, as it's always good to check in with genetics just to see what's changed in the past few years. But sometimes we have updated testing and sometimes we don't.
I think kind of building off of that, it can depend on what you were initially tested for. So if you came in with your child as like a PEDS case and we came to a diagnosis that very much explained what we're seeing in that child, so we identified a genetic change, explains child's condition, I would say it's much less likely that there's going to be updated testing or any change for that child testing wise. Might be worth checking in with genetics to make sure there isn't change care-wise for that individual, but testing likely wouldn't change. In the cancer realm, if you came in 10 years ago because you had breast cancer and your grandma had breast cancer and you had testing, I can tell you there is a lot more genes associated with breast cancer now, and updated testing is actually part of that NCCN requirement or testing criteria, so to speak, that Emily mentioned. So I think it's a great suggestion to check in to see, but it can be a little bit context dependent as well.
Excellent, thank you. What is the differences between clinical, medical, and commercial genetic testing?
I think the utility. I think there's kind of two buckets when we think of genetic testing, and one bucket would be the direct to consumer, or testing like 23andMe, sometimes Ancestry, really looking to learn more about maybe where your family came from. So that testing is good for, again, tracking ancestry, but it may not give you that clinical information of, if you're concerned about a condition, they wouldn't be testing everything that we would be testing, and it may not be, it wouldn't be as accurate as the testing that we would offer. On the flip side of that coin, the testing that we offer wouldn't be able to track your ancestry, ethnicity, or countries of origin, or give you information on how closely related you are to someone, as it's more focused on diagnosing and those clinical concerns. So I think they both have their merits, and they both fulfill different roles. But if you're concerned about a genetic condition running in your family, I would suggest that you meet with genetics rather than going through a direct-to-consumer testing company.
Yeah, and I think some of the direct-to-consumer companies are starting to offer some more clinically useful information, but the caveat to that is it's not comprehensive. So there are some genes that, for example, 23andMe will peek at, so to speak. They will not do comprehensive testing on those genes. So we'll see patients come in and say, you know, I had 23andMe testing come back negative, which is great. It definitely reduces their risk for those or certain conditions that they had the health testing for, but it was not comprehensive testing, and we'll still test you for those same things because our testing is much more thorough and better at detecting some of those different conditions.
Excellent. So we have someone in the chat who has 2 kids with normal chromosomes and one with an extra number 9 chromosome. And the 2 kids are now older and want to start their families, and they want to know the risk of having a child with chromosome abnormalities.
So that would be a great situation for a referral to genetics, because not only can we talk about what that chromosome abnormality is, because there's lots of different things that can be going on with chromosome 9, but then also talk to your children about what that specific recurrence risk is, and then talking about what type of testing is available to kind of better assess that risk, because there is really direct testing we can do on individuals for their future children. So definitely come see genetics would be a good answer to that.
Absolutely. And just so everyone knows, if anyone has very specific questions, we will send out the emails of Katlyn and Emily if you do have specific questions or want to even schedule an appointment. But we'll continue with questions. There's another one. Being a genetic counselor, how often, if ever, are these two words separate? Is there a constant fluctuation or balance between reading genes and counseling those that maybe just received bad news regarding their genetic reading?
I think that's a really good consideration of those things can be completely separate in a session. There are sometimes I go into a session and family just wants to know all of that information, that really clinical information. They don't need my support when talking about it. And although I offer it, sometimes that's not something that they need to hear. And on the flip side of the coin, sometimes I end up delving in and talking to individuals about things that maybe don't relate to genetics so much, but make sure that they're feeling supported, whether that be with a diagnosis or other things happening in life. So I would say, I think with everything with genetic counseling, it depends. But something that we're definitely trained to do, of knowing that flexibility and making sure that we're there to support patients however they need it, whether they need that hardcore genetics info, or whether they need that counseling and that support, or some mix of the both. So I think that's a good question. I think one that just depends.
Okay, and I think we have one more question so far. And the question is, what types of cancers are most often hereditary? Are many not hereditary at all?
Another really good question. So I think we in genetics are very careful not to say something isn't genetic, because things are constantly changing. But I would say there are some cancers, if I see them in the context of certain environmental exposures. So for example, lung cancer in an older individual who smoked their entire life, that makes me less concerned for a genetic predisposition versus someone who was diagnosed with breast cancer at age 40. So that's one piece. There can be environmental exposures that very much explain someone's cancer's diagnosis. But then there are cancers that are very common, like breast cancer. And then kind of a parallel for men would be prostate cancer is very common for men. And that's where some of those family health history points can be really, really helpful. So if you are the first person in the family to have breast cancer and you're the only person, that's very different than if you were diagnosed with breast cancer and all the other women in your family were diagnosed with breast cancer. Same with prostate cancer. And that's when people like Emily and I come into play to kind of tease out, is this something that looks more genetic? Is there testing we can do to tease out that genetic piece? Or is this something that maybe is happening by chance or is environmental? Most cancer is happening by chance. Really, the genetic piece is only 5 to 10% of diagnoses. But having someone tease out those pieces from a genetic standpoint can be helpful.
Absolutely. I'm just quickly scrolling through the chat box to make sure there's no more. Okay. So we don't have any more questions, but like I said before, if anyone has more questions, we can relay those on to Katlyn and Emily. And again, if anyone has very specific questions or wants to set up an appointment, we'll tag the department information as well as Katlyn and Emily's information for those that are interested. But thank you both so much for sharing your time, sharing your knowledge, expertise with us. It was a privilege and honor to have you both on for a presentation.
Thank you.
Thank
We
you for
both
having
enjoyed
us.
being here, for sure.
Thank you so much. And for those still on, we will then continue with a all of us presentation. And I am just going to share my screen quickly. Okay, so just a brief overall presentation of the All of Us Research Program. And right after this, for those that wait, we're going to do a prize drawing at the end. So to get started, the All of Us Research Program is a nationally funded program by the National Institutes of Health. And the program is focused on accelerating health research by taking a look at people's lifestyle, their environments, socioeconomics, and their biological makeup. The technical term for this is what's called precision medicine, and a large factor of this is enhancing individualized treatment. And as a healthcare system, we do this, but a goal of the program is to really improve this in order to help physicians and healthcare providers provide personalized care. All of us hopes to enroll 1 or more million people within the United States, and Marshfield Clinic is one of many healthcare provider organizations that make up this program. And a very unique thing about this program is that it gives the chance for people to represent themselves, their culture, diversity, and community. Historically speaking, research was not the most inclusive thing, and a highlight of this program is inclusivity amongst all cultures. It gets people involved with their health, and which helps everyone, especially providers, when taking care of their patients. For providers, it enables them to have more personalized information about the patient as a whole and gives them the upper hand to deliver the right treatment the first time, saving time and cost. For researchers, one of the most costly and time-consuming factors of research is the actual recruitment needed to conduct research. This program allows researchers to already have their cohort in a fraction of the time, saving money, and really in essence saving lives, because you think the time to deliver new research is shortened. And something I hear very often is, why is this not something that we should have been doing so long ago? And I agree every time I hear that. However, something we all can confirm is that we have the technology to do some of the things we weren't able to do even 5 years ago. and people are much more aware and they care more about their health. And a good example of this is the watches we wear, like a Fitbit. They tell us our caloric intake, our steps, and a lot more regarding our health because we care. So the first slide, I talked about the different factors of the program and what it takes to look at. And on this specific chart, it goes into a little more detail. There are things like a zip code, and zip codes have a lot to do with our environmental health. It can determine our water quality, air quality, and many other factors that maybe sometimes we don't think of as often. Our environment is just one essential piece to the puzzle of our health, and there are other factors with more specifics, such as social factors like our upbringing and education, biological like our genomics, and behavioral like our daily routines. And within the program, there are a few steps to get enrolled and get involved. Initially, we ask for consent to be a part of the program. And within this consent includes the authorization to share your electronic health record and to receive your DNA results. After this, there are surveys you can take. And once these initial steps are completed, you may be invited in for physical measurements and biosamples, such as height, weight, blood samples, and urine. There is an additional option to attach your Fitbit to your account to help track your health information, but this is also a process still in the works and something being updated as time goes on. So you've enrolled, you've completed the initial steps. Nobody likes to sit and go through survey after survey or spend time dealing with enrollments, really for anything. But I promise, what you get in return is very beneficial, and you can receive information back, such as your ancestry. You could receive genetic information that may inform you about different preferences, risks, and benefits to your own health. This specific benefit has a lot to do actually with what we talked about today, because genetic counselors can help you read through these results so you have a better understanding of what they mean. You may find out that certain medications work better for you than others, and much more personal health information that really provides the upper hand when seeing your physician. And another benefit to this program that we didn't talk about last week, but are touching on this week, is that much of the public really isn't aware of, but it's something called the Research Hub. And this is an online platform where individuals can access all of us data. Of course, this data is de-identified from participants, but it provides a broad overview of some of the fun information that you can look up and browse. An example of this is the snapshots and data browser, where anyone can explore different data results from surveys or look at key statistics about the participant cohort. And we just talked about a platform that allows browsing from the general public, which is why it's important to cover this slide. One of the most important pieces to the All of Us research program is privacy and security. You give access to your EHR, which can sound like a risk to most, if not all people. And rightfully so, but I can assure that every particle of data is de-identified, and a unanimous code that is not traceable is given to the name or personal data. Researchers have to go and complete an extensive code of conduct, and there's also a certificate of confidentiality that the program works under. Privacy and security is one of our main priorities that we take very serious, and heavy emphasis on the serious and very. And just a quick reference to the first slide as well. This is a national program, so you don't have to be a part of a specific healthcare system to join, and you also don't have to be a patient of a specific healthcare system to enroll through that system. So last week we had the privilege of having Dr. Mile on from LSU Health. This week we were able to have two of our own internal from Marshfield Clinic Health System. So it really is a large network, but unified still in a sense. And I just want to thank you all for sticking around during this presentation. Please feel free to follow us on social media. This is where we post virtual events, videos, other information such as today. So go and check that out. And if you have any questions regarding the presentation today, please email the email provided. And I can't tell if my WebEx icon is blocking that, but hopefully you can see it now. But please, email that. It's in the top middle of the slide, because we are running a little bit behind on time. So I do want to go into the raffle drawing, which is part of the reason maybe some of you stuck around. But I am just going to quickly enter all the registered names into something, and then I will announce a name. So the winner is Rebecca V. You are the winner for today's drawing, and we will reach out to you by email to claim your prize basket, which includes a new blanket and tumbler, which is perfect for staying cozy as it gets colder outside. I just want to thank everyone who registered for the two-part series of The Story of Your Genetics. We will be sending out the recordings of both segments, so if you were not able to attend one or both, I encourage you to watch because we had some fantastic speakers. You can check out our Facebook page, as we typically have early announcements of upcoming virtual events like this. And we encourage feedback. Please comment on our Facebook post and let us know who you want us to have in our next virtual event. And again, thank you. And we hope to see you at our next All of Us MCHS event. Thank you so much.